Should you try cupping therapy? Let's find out.
Hey everyone, welcome back to another episode of Twins Talk Therapy. I'm Adam.
And I'm Aaron. We're both licensed massage therapists, and I'm also a licensed athletic trainer.
And I'm also a licensed physical therapist assistant. And together we have a combined 30 years of experience in those fields.
In today's episode, we're going to discuss whether or not you should try cupping therapy. So a lot of you have probably seen cupping therapy done and probably seen the marks that are on people that have had it done and wondered, should I try this? What's it all about? So we're going to just discuss a couple reasons why you might want to try cupping therapy for yourself. The first one is going to be if you have tension areas, or what a lot of people call knots, which are just more than likely trigger points within a muscle. If you've noticed you've suffered from those, you might want to try it. Another reason why you might want to try it is whether you have IT band syndrome or suffer from runner's knee, and that's just pain and tightness along the IT band tract along this outside of the leg. So it might be worth trying cupping therapy for that. Another reason is if you have overuse injuries, whether you're an athlete and you're doing repetitive use with a certain body part and you notice certain muscles are tight and sore, or whether it's work-related repetitive use, if you're on an assembly line or just your work requires a lot of repetition and overuse in that sense. And lastly, another reason why you might want to try it is if you notice, whether it's in the mirror or someone mentions to you that you look like you have a muscle imbalance, whether it's shoulders, in your arms, potentially in your legs, it might be a good idea to try cupping therapy.
So I'm going to give a history of cupping, and it actually started well over 2,000 years ago. Some records show that the ancient Egyptians were using cupping thousands and thousands of years ago, but it definitely has records of the ancient Chinese around 2,000 years ago using cupping. Aaron and I learned about cupping in massage school, but it didn't really become popular until 2016 when Michael Phelps had those bruises on his body from using cupping therapy, and everyone started to wonder what was on his body and what was this new cupping therapy they were hearing about. Turns out, even though it wasn't new, a lot of people have been using it, particularly athletes, to work out soreness for a long time. All right, so we're also going to talk about a couple different types of cupping in this video. One being static cupping and the other being dynamic cupping. Static cupping is just when you apply the cups to the skin and you let them do their thing. And dynamic cupping is when you apply the suction with the cup and then you'll use a lubricant and add motion to the cup while it's suctioning, so you get like a myofascial pulling effect. So we'll show some exercises while cupping next, and also show some cupping on the table.
All right, so next we're going to demonstrate how you can apply cupping while doing some dynamic exercise along with the cupping treatment. So I have rock pods, which are through rock tape. They come in two different sizes. So for this demonstration, I'm going to be using the smaller cups. And I'm going to be targeting the back of Adam's left shoulder and put the cups on his external rotator muscles because he has a little bit of pain there. And so I'm going to just plunge them on here. And so if you invert the cup, fold it backwards and then push down, and then you can leave the shirt or just pull the shirt over top. And so then, Adam, I'm just going to have you do some external rotation exercise with the therapy band. And so he's going to do a few reps and sets of that, and while getting the decompression effect on the myofascia and muscle tissue with the cups.
All right, so next I'm going to demonstrate those two cupping techniques we talked about at the beginning of the video. First one was the static cupping, and to do that, I'm simply just going to take a silicone cup like this and collapse it down and let go, and the suction is already going. You can kind of pull and drag on that, or you can just let it sit. You can do some twisting, that'll release some fascial adhesions, but you can also apply lotion and do some myofascial gliding with the cupping. But to do the dynamic cupping, I'm going to put plenty of lubrication down so that I get some good glide. And then I'm going to take the cup, and I can start gently, just pushing down a little bit and getting a little bit of suction. And then I can just glide that cup along the skin, and it's going to cause like a rippling effect as the skin lifts up into the cup and then lays back down once the cup passes. It's going to be kind of like creating a wave in your skin. What that's doing is lifting and separating the layers of fascia from the muscle tissue and the skin tissue on either side of the fascia. I can also push down a little bit further, letting some more air out and create more vacuum inside the cup, and re-glide down. And as you get the skin and the fascia loosened up, you can apply more pressure with it still being comfortable for the client. But then when you really start going with more suction, you'll get petechiae and a lot of redness. That's just drawing blood flow to the surface, and it's really separating those layers of tissue. So these two techniques feel really good on the back and the IT bands, and you can use them other places, but those are the two main places we use them. And that is all for our technique. So after showing you those two techniques, what you'd like to do is ask the cupping therapy provider if they offer static and dynamic, but it would be nice if they offer both so that you can get the benefits of both techniques.
All right, everybody, we hope you enjoyed this video about cupping therapy. I want to remind everybody that our videos are meant for informational purposes only and that should not be used for medical advice.
And as always, if you guys have any questions or you have topics for future videos you'd like us to do, you can reach us at twinstalktherapy@gmail.com or leave a comment below the video.